at cspan.org/coronavirus.
Now an update from New York Governor Andrew Cuomo. He ordered the state's hospitals to increase capacity in beds by 50% to handle coronavirus patients. His announcement came during his daily briefing with the press on the state's response to the virus. Other state officials also joined Governor Cuomo for the 45-minute briefing in Albany.
Good morning, everyone. The weekend is a little different when you're not working during the week, but let me introduce the people who are here today. We have Dr. Howard Zucker, who's starting from my left, who everybody knows, our great health commissioner. We have Stephen Cohen, who was secretary to the governor 2010 to 2011. He also was the top assistant in the Attorney General's office when I worked there. Former federal prosecutor, and he's now with McAndrews and Forbes. Robert Mujica, the budget director. Cara Kennedy Cuomo, who gives me great joy that she is going to be helping us out. When I was her age, I came and worked with my father in this room as special assistant to the governor for $1 a year. I will give you the $1 a year, but it's she's not working for obvious reasons, and she's here to help, and that's a joy to me. Melissa DeRosa, who everybody knows, she worked for President Obama. She was Chief of Staff to the Attorney General. She's been working with me for 7 years. She's current Secretary to the Governor. Larry Schwartz, former Deputy County Executive Suffolk, former Deputy County Executive Westchester, former Secretary to the Governor Patterson, then former Secretary to the Governor under Governor Cuomo, 2011 to 2015. And Bill Mulrow, a financial expert, Secretary to the Governor 2015 to 2017. The reason I want, it's also the most competent group of government professionals that you could put together to address this difficult time. I've worked with these people for 30 years. We've gone through all sorts of different situations together. We did Superstorm Sandy together, the Ebola virus together. We've had problems with the federal government. We built airports, roads, bridges. So they are just the best team that you could have working on behalf of the state of New York. And I thank them all very much for their help and their assistance and their volunteerism, because most of them are not getting paid. You're getting $1. The increase in the number of cases continues, and that is what we're watching every day. They see it as an upward trajectory. I see it as at one point, and the question is, what is the point of the break? And when the wave breaks, does it crash over the healthcare system, right? That's what we've been talking about. So 2 tracks simultaneously. You have to reduce the spread of the rate of the virus, the rate of spread of the virus. You're not really going to control the spread, but you can reduce the rate of the spread so you can handle it in your hospital system. That's what every state is doing. That's what this is all about. How do you reduce the rate of spread? Reduce the density, do more testing, isolate the people who test positive. Second track, increase hospital capacity as quickly as you can, so that at the apex of the wave, you have the hospital capacity for the people who will need the hospital capacity, which are the vulnerable. Reducing the spread, density control. We've taken every action that government can take. Close gyms, theaters, other high-density businesses, non-essential employees, social distancing. Matilda's Law, remember, this is about protecting vulnerable people, older people, senior citizens, compromised immune, underlying illness. Those are the people who are vulnerable here. That's the focus of all of this. The greatest density control issue right now is in New York City. I saw the issue myself. I told New York City I want to plan. Yesterday I said I want to plan on how they're going to control and reduce the density. I want the plan today. I want the state to be able to approve the plan. It has to focus on young people and the gap. You can get it. The numbers show you can get it if you're a young person, and you can transmit it. It's reckless and it's violative of your civic spirit and duty as a citizen, as far as I'm concerned. If New York City needs legislation to enact their plan once we approve it, I would ask New York City to pass that legislation quickly. If they have a problem passing legislation, they should let me know. Also, on reducing the spread, increase the testing capacity. When you identify somebody positive, isolate that person. What we've done on testing is important.